Good evening and welcome to Arizona Horizon. I'm Ted Simons. For many Arizona seniors, the choice between original Medicare and Medicare Advantage plans can be confusing. While Advantage sounds like a benefit, the Arizona Hospital and Healthcare Association is warning patients that Medicare Advantage may not be an advantage at all. Anne-Marie Alameddin is president and CEO of the Arizona Hospital and Healthcare Association, and she joins us now. Good to see you again.
Good to see you.
Thank you for being here. We're going to get basic here, okay? What is Medicare?
Medicare is a health insurance program that Americans are entitled to when they turn 65.
Okay. Medicare includes Parts A and B?
Yes.
True?
It does.
And what are Parts A and B?
It's hospital and then physician networks.
Okay. Is it a fee-for-service kind of a deal?
It is for a traditional Medicare.
So Medicare pays for parts of the bill and then you pay for the rest?
Yes. Oftentimes people have a supplement with traditional Medicare as well, a supplement plan.
Okay, supplement plan, is that through private insurance?
Through private insurance that will enhance coverage. You pay a premium to get additional benefits in terms of prescription coverage and hospital stays.
So Medicare itself covers necessary health care, necessary supplies, most but not all?
There's Medicare criteria where patients have to meet certain criteria to get coverage for certain conditions. That's all very transparent. Physicians know what that is, hospitals. And so once a patient meets criteria, they don't need to go through any sort of prior authorization process. They meet criteria, they get scheduled, the procedure happens.
How would they meet that criteria? Give me an example of that.
Well, it could be for an operation, say appendicitis.
Yes.
And so, appendicitis is a bad example because that's an emergency surgery usually. So it's not something that, for medically necessary criteria, a good example would be a hip replacement.
Yes.
And so there's degenerative tissue in the bone. You need a hip replacement. You meet certain criteria. You can get scheduled to have that hip replacement. Perhaps there's some rehabilitation that takes place afterwards in a rehabilitation hospital to make sure that patient is able to function at a higher status and ambulate in their home, and so they're able to get rehab services, and then they're discharged. So it's a fairly streamlined process for traditional Medicare.
Okay, for traditional Medicare, no prior authorization, no waiting around, it's all taken care of.
No prior authorizations as a part of Medicare Advantage. There might be a wait in terms of scheduling the surgery, dependent upon other patients who are waiting for a similar surgery, et cetera.
Medicare, what about prescriptions? What about routine eye care, dental care?
Not a part of traditional Medicare, dental and vision, not necessarily. Certain things may be, but I think Medicare Advantage kind of wraps in a lot of dental, vision. It includes Part A and Part B, and that's managed by a private health insurance company.
I want to get to Advantage in a second here, but I'm still stuck on Medicare. I'm still trying to figure out Medicare. As far as prescriptions, though, that's Medicare Part D?
Yes.
Yes. So we got A, B, and D. I think did we get C in there? No, Medicare Advantage is, okay. All right. It sounds a little confusing even from the get-go. It
is confusing, and I think it's hard when people are turning 65 to really navigate that, to figure out what the best option is for them. Is it traditional Medicare or is it Medicare Advantage? It's complex, and I think with Medicare Advantage, there's a lot of different private health insurance companies that have different plans with different coverages, with different co-pays. So it is a lot to navigate.
So let's get to Part C, Medicare Advantage. What is that?
Medicare Advantage is where a private health insurance company is managing Medicare for an individual. So you're no longer using Part A and Part B. You're using a Medicare Advantage plan through a private health insurance company that is managing your care. You don't have to meet that Medicare criteria that a traditional Medicare beneficiary would. It's the criteria of that private health insurance plan. That could include prior authorization processes. It can include peer-to-peer review in terms of physicians. So there can be more administrative hurdles to get the medically necessary care that your physician is indicating is appropriate.
But it also it includes vision and dental care.
I think some plans do. Not all.
Not all?
Not all. But
okay.
Many plans do.
Prescriptions?
And prescriptions.
Okay, so I'm trying to figure out the benefit of Medicare Advantage, and it sounds like there are some benefits.
Yeah, I think from a consumer perspective, it appears as to be more streamlined, where that you're kind of combining all of the different services into one package.
These are HMOs and PPOs?
Yes.
And what are those?
Well, you can have a broader network through a PPO or a more narrow network in HMOs. And I think the networks are also very different. For traditional Medicare, that's one of the broadest networks any person could be a part of. Almost every hospital, many physician offices are part of Take Medicare. But in Medicare Advantage, the networks are much more narrow. So I think it's really important, if people are considering Medicare Advantage, to talk with their physician and make sure that their physician is a part of that network. I think it's even more challenging if you live in the rural parts of Arizona, where the networks are even more narrow, to make sure that you can go to your favorite physician and you can go to your favorite hospital as you have through the years.
In terms of cost, are they similar, or everything seems to depend on the plan with Medicare Advantage, doesn't it?
It does. It does. There's very different premiums and throughout different types of Medicare Advantage plans. So you really have to, I think, be buyer beware as you're evaluating this. And I think there are a lot of brokers out there that are making money from selling certain insurance products through Medicare Advantage. And so you need to go to, have a trusted family partner and make sure that they're helping you navigate this. There's also state resources like the Arizona State Health Insurance Program, AzHHA.org. They are a neutral party, and they can look at networks and look at benefits and really try to help you in an unbiased way, try to find the plan that's best for you.
Yeah, because if you have a couple of doctors that just simply will not apply to certain programs on Medicare Advantage, Medicare might be better, but then again, Medicare Advantage might be better because you can get certain price breaks and you can get the vision and dental care come along.
Exactly.
So they will be able to look at your plan, look at your physicians, and say, we think this one might be a little better for you.
Exactly.
Are the hospitals seeing patients come in who have absolutely no idea what's covered?
I think that's very frequent, absolutely. I mean, healthcare is incredibly complicated, from Medicare to Medicaid to commercial insurance plans. I think patients are often confused. And I think there's a lot we need to do to try to streamline the system and make it more patient-centered and patient-friendly and affordable.
You mentioned with Medicare you can get supplemental. That's again through a private insurer. Medicare Advantage is through a private insurer from the beginning. Can you get the supplemental there, or is the Medicare Advantage it?
Medicare Advantage is it. It would not require a supplemental program, a supplemental plan.
So for viewers watching right now, and the last question, I hope I made sense of all this. What is the most important thing to know? Is it basically to know your doctors, know what you need, and just compare and contrast?
I think the most important thing is to do your homework and really for buyer to beware that Medicare Advantage may seem more streamlined. And if you're a healthy 65-year-old and you feel like you know what your medical conditions are, that's great. But as we all know, things happen. Traumatic injuries happen, strokes, heart attack. And if you're in a hospital and you're wanting to have sort of a transfer to a rehabilitation hospital that is at higher level of care, if you're on a Medicare Advantage plan, they deny those transfers more frequently. So you're at risk of not being able to get the care that your physician is saying is medically necessary. So I think it's really complicated, but I think it's important for people to be educated and to really weigh those issues.
Well, I hope we helped them tonight here, Anne-Marie.
I hope so.
Again, Arizona Hospital and Healthcare Association, great information. Great to see you.
Good to see you.